What's up?
Hey, what's happening?
Your yard always looks so peaceful.
All trees behind me. It's like this is my quiet place.
How's the lighting? Is it okay tonight?
Yeah, you got the funky blue light again. I like that.
Yeah, I wanted hot pink, but someone said I should have blue because it's on brand.
Gotcha, gotcha. All right. Well, I don't have any light.
But
I don't have light, but I have my Captain America shirt on.
it's all that matters.
Right? Can you hear me okay, or should I get the microphone?
No, you sound fine.
All right, cool.
I don't have my mic connected anyway. Am I okay?
Yeah, I sound good.
All right.
Got some people. Hi, everybody.
Yeah, we got people rolling on. It's been quiet lately because everyone's going crazy back to work and stuff, but yeah, this is cool. So I figured we would kind of go back to doing you okay?
Yep. Just move my chair around.
Go back to doing something pretty simple, which is a question that I'm sure you get a lot and I get a lot is what is the best method of delivery for TRT? As we know, some ways are a little bit more optimal than others and some are more convenient than others. But let's start off with like pros and cons of each and kind of go down the list. How does that sound?
Yeah, I think that's a great idea. I like getting back to basics and keep it simple, So, yeah, you probably get this question a lot. I do all the time, like, what's the best route? And, once again, it depends, right? Everybody's different. I always present the pros and the cons of both therapies and then let the patient decide, what do you think based on it's not just about what works better physiologically, but a lot of it's lifestyle. So let's go through the list. With testosterone, typically there's creams or gels, there's injections, there's pellets. Those are really the big three. With women, they can do two forms of topical. They can do a topical cream, which is applied to the skin like the inner arm, and there is actually a transvaginal cream. A lot of the hormones are very effective when applied transvaginally, whether it's a cream or a troche or something along those lines. They work really, really well, obviously at much lower dosages, but again, some women don't feel comfortable doing that, others don't mind. So those are the biggest.
It's scrotal cream for women, basically.
Scrotal cream for women,
Yes.
like Allie's doing. It works great, right?
That's what I mean, you just rub it on your scrotum. And might I just say, we had a question a few weeks ago. Someone actually asked if women use scrotal cream. Legit.
Yes.
No.
You do now.
No wonder yeah, anyway.
I do not recommend rectal administration, however, but all the other forms we mentioned are good. So, sorry, Charlie. That's gonna be my. So I think I would say most of my men are on injections. I have several that are on creams and like it very much. My women, it's kind of almost half and half on cream, half on injections. And I still got a handful of patients that still love pellets. I mean, and I like pellets. They're fine for certain people, but I know sometimes they get poo-pooed a lot by other people or clinicians. But they have their place and they do work. But it's definitely not where I'd like to start because I like to figure their body out and titrate them, and you can't really titrate a pellet, at least in the beginning. There's ways around that, but in the beginning, I prefer not to start with a pellet.
I've heard such horror stories with pellets. And then I've had like some doctors in town that have had patients on pellets, and then they call me and they're like, what do I do? They're having reaction. And I was like, what do you mean? What do you do? And then they end up giving them like an anti-estrogen. And this is for men. For the women, we're a little bit more reactive to stuff. But anyway, let's back up. So with injections, there's different size needles, because I know a lot of people don't like needles and they think that injections are very similar to when you get blood drawn where they stick like an 18 gauge in your vein. So the higher the gauge, the smaller the needle. And you can choose what size needle you want to inject yourself with. And people can inject themselves, right?
Correct. Absolutely.
Yeah.
In the old days used to be the intramuscular shots, and they typically would be slightly bigger and deeper, and of course in the muscle, which is very painful. And a lot of guys still like that, but I think most people are doing more sub-Q injections right into the skin, right into the fat layer. Because you can use a smaller needle and it doesn't go in as far and it's much less painful. The thinking of, oh my gosh, it's going into the fat and it's going to aromatize and estrogen. I mean, there, certainly scientifically there's some thought, but I've never seen that clinically, and most of my colleagues don't either. Again, it's not really an issue, especially if you're dosing them properly. So for me, I think it works just as well. I mean, our beloved dear departed friend Dr. John Crystal used to always say that it would actually have better absorption and actually more. So like 80 milligrams of sub-Q is equal to 100 milligrams of IM. I don't know if there's any scientific truth to that, but sometimes you can go a little bit lower because it absorbed more slowly over time compared to the IM shot. So me personally, I prefer for my patients, the sub-Q, because again, you can use a smaller needle. It's much less painful. And like you said, a lot of people are needle phobic. And when I explain them or I show them the needle, they're like, oh, that's no big deal. I can do that, and then it's no problem. Kind of like with peptides. We can use tiny little sub-Q injections and no problem whatsoever.
And I think, because I know a lot of guys think sub-Q has to be every day, but it doesn't.
It doesn't have to be. Some people do every other day. Right. You can microdose it, 5-7 days a week, and that's probably the most physiologic way to do it, truthfully. But you get into the kind of the pain in the butt factor, kind of like the cream. A lot of people don't like the fact you have to apply it every day. With the convenience of the injections, that you can do it twice a week or 3 times a week, that kind of thing. In the old days, you probably remember guys would get a huge dose every 2 weeks, and we learned that that's not the way to go, because then it spikes and crashes, and side effects are more prominent and this and that. So it's much more beneficial to do it. Most of my patients are usually twice a week. Some are doing 3 times a week. I don't think I have too many that are doing it every single day. It is a very physiologic way to do it, but again, you get the whole point of the needles is more like my lifestyle. So my patients that are very busy, entrepreneurs, that they're working their butt off, 50, 60, 80 hours a week, they don't have time. So they'd rather just dose it once or twice or something like that a week. It's just a lifestyle issue. So, and that's, so.
There's still a lot of guys that are like every 10 days, every 14 days on that protocol. And, we've been over this before, where if you guys have somebody giving you a protocol from 1995, similar to like the fitness industry giving crunches from 1995, find another doctor to work with.
Right.
Because it's obviously suboptimal, because then people wouldn't question it if they're feeling great. They'd be like, yeah, I feel great. And that does work for a very small handful of people. Right. But there's a reason why we've evolved, and medicine now realizes, well, you release testosterone naturally every day, so why wouldn't we try to align those injections with that same release pattern, right?
Right, exactly. And, in case in point, some people are they metabolize differently, right? That's why I look at some of their lab work and look at like their serum hormone binding globulin, or their lifestyle, or just their overall metabolism. I have one patient in particular, it took a little while to figure it out, because he would metabolize it very slowly. Even though we were breaking up his doses, he would get some water retention, some other issues, and we finally found the right spot. So he was kind of like an every 5-day thing, and a kind of a blend of the faster and the slower acting forms, and finally hit it. But it took a while, and it just takes time sometimes to figure people out based on how they metabolize the testosterone, because that's big important. Their liver health, their SHBG levels, their metabolism, their lifestyle, all those things kind of come into play. So it's not just like a cookie cutter thing.
And then most pharmacies, so let's talk about like the esters. Most pharmacies will prescribe testosterone cypionate, which is probably the most popular, right? Because it has the longest half-life. Then there's enanthate and propionate. Nobody does really suspension, right?
No, not really. I've had a lot of patients who have really liked, we kind of do an 80-20 blend of cypionate and propionate. They get that little bit of cypionate, which is a little faster acting, faster metabolized, so they feel a little faster, but it also gets metabolized more quickly. That little blend seems to work pretty nicely for a lot of people. Not everybody, but it works pretty well.
No, I've heard a lot of guys are very happy with that. How come some pharmacies will not carry that? I literally have asked pharmacies in town, they're like, test what?
You know what? Yeah, I try mostly just to work with the good compounding pharmacies that's all they do is bioidentical hormones, and they're very, very, very well versed and can make any combination that I need. It works much more smoothly that way.
And so what would be, for women, what is an injection dosage frequency and amount? 20 milligrams, 15?
Yeah,
can you even get that low?
You can. It's a tiny amount, and those are typically used in very small syringes or even an insulin syringe. So some women, I'll go even as low as 5 to 10 milligrams a week. But, for
injection?
Yeah, and that's not, sometimes I'll start if there's any question, but I'd say most of the time we're going to be upwards in the, like 20 15 to 20 to 25 milligrams. That's a good point to go. But again, I'll typically start a little bit on the low side and work my way up, especially if they're, depending on their symptoms and things like that. So,
I know, like I get this too, even if it's an insulin needle or a bigger needle, is when I inject, sometimes I get some PIP, which is post-injection, like pain or swelling or redness. So what recommendations do you have for people who experience like itching or some sort of inflammatory reaction? What could cause that?
yeah, some people are just more sensitive to that, and sometimes it might be something as simple as the oil that the testosterone is suspended in. There's a couple different forms. Grapeseed is probably the most common one, and most people do well with that, but very occasionally off someone who's sensitive to it. So it might just be switching the oil around. That might be all it needs. A lot of times I'll recommend people after you do an injection to kind of gently massage the area for maybe 30 seconds to kind of, and that seems to help, especially those people that get like some redness or irritation. Just kind of, it helps to diffuse a little bit and kind of just works it into the tissue a little bit. Obviously, it's going to be absorbing much more slowly, but just it just seems to work just doing that. But if it's still persisting, then it might be a question of, again, switching the oils, switching the form, maybe breaking it up, doing a smaller amount each time. Sometimes it might be too much in the tissue. So if you're doing one big dose or two big doses, maybe divide it into 3 doses per the week, or so it's a smaller amount going into the skin. Sometimes that's worked as well too. So
You know what I want to try? I want to try injecting and then the Theragun like on my stomach, because the peptides do that to me. Like, I feel like I got black and blues all over the place.
Oh, really?
So yeah, I figured the Theragun would be kind of funny. That's like a joke though. So.
There you go.
All right, so moving on. The scrotal cream for men, you said it has to be applied twice a day. Where exactly on the scrotal area?
Well, depends who you're with and what you're doing. So
some guys ask me though, they're like, can you have sex, or do you have to abstain from sex within a certain time frame if you're using the creams?
yeah, no, basically you just want to apply it, just kind of liberally smear it. It doesn't really matter where you put it on the scrotum. Most of my guys, I'd say like do it first thing in the morning or right before bed, maybe right after you shower. Kind of wash all the oils off and you're nice and clean, and then you apply and you just kind of let it dry. And but yeah, you have to. The biggest issue with that is what I warn patients is the issue of transference. So yeah, if you're snuggling with someone right away, yeah, you could risk transferring the testosterone to whoever you're with, whether it's your significant other, your kids, or heaven forbid your dog or whatever. So you don't want to do that. So I tell everybody about 30 to 60 minutes is usually sufficient. If you want to play it safe, just wait an hour, and then you're usually good to go. Could it still a little bit trans, but yeah, if you're gonna have sex, then yeah, go for it. But if it's within that first hour or so, yeah, there's a chance that a little bit will get transferred to your significant other. So
that's creams.
A lot of guys will do. Yep, that's cream. So cream, on the arm or on the inner arm, another location, as well as on the right on it more, and they get a better effect. You get more of a conversion into DHT, which has kind of gotten a bad rep because a lot of the benefits you feel actually come from the DHT. It does a lot of things positively in terms of libido and strength, etc. So that's not a bad thing. It is something you have to be cautious of. If you're genetically predisposed to balding or something, it could accelerate that. But that's more of a genetic thing. It's kind of a myth that it's just you're gonna go bald just because you're cranking up your DHT. So scrotal is a great way because it's awesome and very, very good absorptions to transvaginal in women. But if you don't want to do that, yeah, you could just apply it to the inner arms, to the inner thighs. Anyway, skin's kind of thin.
And then Natesto, has that hit the market in the U.S., the nasal spray?
Not that I'm aware of. It may have. I have not heard about anybody using it yet.
I lost you there for a minute. Because I think that's popular in Europe. So basically, and then we never hear about the gels anymore. So Andrew gel obviously is garbage. So we never hear about that anymore. So, and there are guys that actually, whose doctors want to put them on that.
Sorry, I lost you there for a minute. What was that last part?
About androgel. Like there are doctors that still try to put men on that, and it's garbage, and we don't hear about that much anymore. So like, why do people still try to prescribe that?
I don't know, and I think most people are getting it from either clinicians who aren't up on the current literature, or just a kind of old school type of stuff, or maybe they're trying to get it approved through insurance. But yeah, androgel and testim, they're just it's testosterone, but the dose, the percentage, the concentration is so low, it's just clinically almost useless. You get occasional guys will get some benefit, but it's just not nearly strong enough. So that's why I've used a much higher concentration from the compounded pharmacies. Works much better, and really no side effects. So yeah, huge difference.
And what about, so the troches, which are like, they're like gummies that dissolve in your mouth for men? How are those effective for men?
Yeah, I've not really used those too much. Some of those can be effective. Sometimes it could cause they work. They are absorbed, obviously, but some people get some gingival irritation of the skin, and it's kind of bothersome. So I've not really used that too much. Probably remember in the old days they used to give like an oral form, which wreaked havoc with and killed your liver. So that's not used anymore. Now there is a micro, kind of like a lipophilic kind of form that you can give to older women. That's actually well absorbed and doesn't cause any liver problems. So if you have someone who's older and they don't want to do any other forms, that particular type of it's like a micronized form that's very well absorbed and it's not a cause of liver problems. But it's not for men; it's mainly just for women. So yeah, I'm not used the buccal form really at all with too many of my guys or my women really. But it's
I want to be like the 75, 80-year-old woman who's like injecting in the butt. Like, yeah, like I am. Let's do this. Yeah.
right.
People think I'm nuts. All right. Any other forms? Did we go over everything?
I think we covered them all. Yeah, those are the biggest ones. I think, touching on the other one was the pellets we talked about a little bit. Again, that's more of a lifestyle thing. If someone's who's really on the go lifestyle, they just don't have the time. They're just got a crazy business work environment, that might be an option for them. But again, I like to start them on some other forms, find their sweet spot, and then do the pellet. But it's definitely not my preferred choice.
Can you describe the procedure in which a pellet is inserted in case people don't know?
Yeah, pellet basically it is a surgical procedure, but it's done in the outpatient, it can be done right in the clinic. It takes me 5 minutes. So, but basically we are anesthetizing the skin, basically in the upper outer butt area, with lidocaine and obviously making a tiny little incision. And we actually have a little device, kind of multi-part device, a little trocar that actually will insert the pellet, which is basically it's the hormones. It can be estrogen, progesterone, testosterone, but in this case, we're talking about testosterone. It looks like a little tic tac. So depending, men will need a lot more than women, of course, but there's a special device you have to use to insert it, and you have to get it in the right area so it doesn't come out or cause any problems. So you have to do it a very particular way. But once it's in, the wound is closed and it's covered up. It's basically like, it's just like I said, it's just a mini surgical procedure. It doesn't take terribly long, but it is mildly invasive. You are making an incision in the skin, and you're going to be a little sore, may have a little bit of discomfort for a few days. So it's not it's not like a shot where you could just go out and you're not going to feel anything. You have a wound and it has to be dealt with appropriately. So it has to be treated with respect. So it works. A lot of my patients love it, but that's kind of how the pellets work.
Interesting.
Yeah.
What else was I going to ask? I already forgot. It's close to bedtime.
Any other questions from anybody who's been fired?
Yeah. Anybody? No, but everyone's kind of quiet lately. Nobody wants to heckle me.
Everybody's recovering from the weekend. Another weekend of screwball whiskey, maybe. I don't know.
No, it definitely wasn't my clientele. You guys know who you are. Some of you are on this podcast or whatever.
Yeah, they will not be admitting to you. I'm sure they're scared.
The alcohol one, they were probably like, yeah, that's cool. All right, we can go drink.
Yeah, exactly.
All right, cool.
Yeah, if anybody has any questions, feel free to fire them off. Happy to answer anything.
Going once. There's Will. Will, you're late. Sorry, we're ending. All right. Well, thank you for your time. Joey says, thank you, doctor. Thank you, Joey.
Absolutely. It's fun.
Yeah, you're welcome. All right. Bye, guys. Have a good night.
Welcome. All right. See you guys. Take care.